Brian? Always a pleasure.
All right, so if somebody is hypotensive, like their blood pressure is less than 90, they're also tachycardic, they're in shock. What level trauma center ideally should they go to?
Level 1.
1. Yes, good answer. If they have 2 or more proximal long bone fractures, where should they go?
Level 1.
Level 1. All right, good. What does the platinum 10 minutes refer to?
10 minutes on scene, then transport.
Yes. So we used to talk about the golden hour. So the time of injury to the time of the person getting to surgery. Okay. The platinum 10 minutes is basically you were on and off the scene in 10 minutes, unless that person's entrapped. Okay. So you get there, you stabilize their spine, treat any major things that's happening right away that you have to stop, like bleeding, and put them in the ambulance and go. Do the rest en route. Okay. You already know to study your Newton's laws. And you know to study Waddell's triangle, or triad, sorry. So, sometimes these questions are a little wacky, but that's how FISDAP questions are. Okay, so you gotta think about it. So let's break this down. Listen to this. A vagus nerve mediated form of cardiogenic shock. Okay, so what are we thinking about here? What does the vagus nerve do? Slows down the heart rate, right? So it's gotta be, one answer has gotta be bradycardia, okay? If somebody's bradycardic, what happens to their blood pressure?
Drops.
They're hypotensive, so you don't even have to read the rest of the question to get the answer, okay? The rest of it is, the whole question is a vagus nerve mediated form of cardiogenic shock without compensatory vasoconstriction that may be seen following a blast injury would most likely present with bradycardia and hypotension. Okay, so that's how you kind of like look at it and break down questions like that. Okay. All right, we've got the lethal triad question, which is up on the board there. So acidosis, hypothermia, and coagulopathy. So meaning they're not clotting, okay? They're cold, and they're acidotic. And those things interact with each other, and it's like a vicious circle, and they die unless you stop them, okay? So that's why it's important to keep our patients warm. All right. How does the body achieve hemostasis? How does it try to stop bleeding? What does it do? Right, but what, like, what's the, like, the physiological response? Like, you see the compensation, but, like, what's happening, like, on the inside?
Like inflammation.
Okay, that's one part. What else?
Inflammation.
Inflammation. Yes. Yeah, so what specifically clots? Platelets, right? And your vessels vasoconstrict. So vasoconstriction and platelets. Okay. So what would have the most negative effect on the body's process of hemostasis? Well, yes, but what else? Like
Hypovolemia.
think about like a medication somebody might be taking. Yes, anticoagulant use. Because then the body's really behind the 8 ball and can't really clot, right? All right. You cannot stop someone that's got a bleeding brachial artery with direct pressure. What do you put on it?
Tourniquet.
And
Oh
then
wait, this is
And then how else do you treat them?
treat them for shock.
How?
Supine, high flow oxygen. You looking for pressure dressing? I forgot if that was the static dressing. Treat 'em for shock, rapid transport.
So oxygen, rapid
Warm.
transport, start an IV injury. Keep them warm, right? All right. So, when you're thinking about the body being able to compensate, do you think it's easier for the body to compensate if something is happening more slowly or more quickly? Slowly, right? So the body is least able to compensate if you have like rapid blood loss, right? That makes sense. Okay. What?
So sometimes I feel like it's like too obvious and I don't want to answer.
Sometimes it is. Don't overthink it.
Keep it simple, stupid for trauma.
Yes. Which of the following is the most common cause of necrotizing fasciitis? It's a type of bacteria. It's a very common bacteria. Yes! Very good. Hemolytic streptococci. Good job. All right. Hemolytic streptococci. All right. What type of injury can cause the highest risk of infection? Burns, open fractures. What if that's not a choice? Some other stuff.
Abdominal injuries with penetrating to the hollow organs.
Okay, keep going. Yep, all true.
Any open wound?
What? It's basically a bite, human or animal.
Human.
Human is worse than animal, yes. We have a lot of bacteria in our mouth. Do I want to know? Probably not.
I was
Okay.
being a piranha.
When? Of course you were. Why did I even ask? All right. Crush injuries.
Bad.
Yes. So what happens? Bad things, right? So hyperkalemia, because basically what happens is if there's no circulation and things are crushed, the muscles break down, which is myoglobin, or is a bigger molecule that causes it clogs up your kidneys. Okay. Potassium goes higher because the cells are being crushed. Okay. And so now you're acidotic. And when whatever is crushed gets released, that's when the problems start. Okay? So, our protocols basically have us giving lots of fluid and bicarb like 30 seconds before we take the stuff off the person. So, 1 limb, 2 hours, 2 limbs, 1 hour, basically is the guidance in terms of when it's going to form crush injury. Okay.
And the bicarb for that's med control, right? Or is that
I think it's standing.
It's standing for
Standing
that.
for
Yeah.
Hudson Valley, it's med control.
Is it?
I was like, I thought of it.
Hudson Valley's med control. You're supposed to call for it.
Oh.
But New York State is a standing protocol.
Okay. Sometimes I have to look stuff up because.
I only know that because of Sandwich Lady.
Yeah. I mean, if you have somebody with crush injury, it's going to take a while to get them out. It's probably not a bad idea to call the doctor to begin with, so they know what to prepare for, right? Or, maybe direct you elsewhere. So, let's see. So anytime you have damaged muscle, which can also happen with electrical injuries, remember that it releases myoglobin and can harm your kidneys. What are we worried about with facial injuries?
Airway.
Wait, back to the kidney damage, the electrical injury.
Yeah.
It's the
Myoglobin? Alright. What kind of injury requires substantial irrigation and debridement prior to closure? I will give you some choices. Degloving, jagged, any wound to the face, or wounds over tension lines.
Wounds over what?
Tension lines, like skin, like where, basically where your skin, like, is around a joint.
Degloving.
Yes, degloving injuries. Has anybody ever seen a degloving injury? They're quite dramatic. Okay, so that's one of those things that can be very distracting because they're so dramatic. Okay, but again, make sure the patient's not going to die from anything in the ABCs before you deal with it. Okay, do you want that like irrigated and wrapped? Yes. Okay, but if you can get somebody to do that because you're dealing with other stuff, great. If they're not going to die from anything else, okay, great, irrigate it and wrap it. Okay, but I watched one of my patients that got hit by a car, and at the time, we didn't go to trauma centers. It was the closest hospital. Well, they killed her because she had a gloving injury to her forearm, but she was also bleeding internally. But they were so focused on her freaking arm that she died. So, I mean, would she have died anyway? I don't know, but they didn't even like notice. So,
Surprise.
yeah. So, let's see. Let's say you're dispatched to a scene that involves power tools. What should be your first concern? Scene safety. Yes.
Are the cultures like while they're still in patient, cutting patient, around patient?
Around the well, anytime they have an injury from a power tool, you've got to make sure that it's not on. You're not going to get hurt by it. So scene safety is your answer. Okay. All right. Know your different levels of burns. And like, anybody heard of the zone of coagulation?
The zone of coagulation?
Yeah, there's a circle that the different, like, it's basically ground zero of the burn. And then, because if you think about burns, they're different, usually different levels. So like, the middle could be like the worst part, and that might be 3rd degree, but then around it there's maybe a 2nd degree, and on the edge maybe there's a 1st degree. So they're not always so straightforward. So there's a picture in your book, and it looks like a dartboard, essentially, and it has the different zones. So it's in your PHDLS book. All right, hydrofluoric acid.
Right?
That's a fun burn. No, it's terrible. Okay, it's very painful, and basically it liquefies your skin and kills it. Yes, it's called coagulation necrosis. Not something you ever want to encounter, and you shouldn't be anywhere near it until they're decontaminated, because you don't want that. Okay. All right. So lightning strikes, they're fun, okay? So, or any kind of electrical burn, the entrance wound is gonna be smaller, the exit wound is gonna be larger. It kind of like bursts out, okay? And it's it takes the path of least resistance through the body. So it's very hard to predict where the entrance and exit's gonna be, okay? If it happens to go through the heart, that's a problem, right? So they can go into cardiac arrest. But if you ever have several people struck by lightning, okay, you do something called reverse triage, okay? Because the ones that are still alive are probably going to stay alive, okay? The ones that are dead, you have a pretty good chance of getting back. So in normal MCIs and triaging, we don't do CPR on dead people, right? But with lightning strikes, your chances of resuscitating them are pretty high. So you start with the dead ones, okay? Because they're most likely in VFib. Okay? And don't think it doesn't happen, because it happened in the city of Poughkeepsie, what, 5 years ago, 6 years ago?
6
Yeah.
now.
In the park?
Yeah, it's like 6 years ago now.
Yep. So, sometimes it happens. Lightning strikes the most, anybody know what state has the most lightning strikes? No.
Is it Washington?
Florida.
No.
Yeah, because people are dumb and they're out on the golf course all the time. They stand under trees and shit. But it also rains a lot, but Florida has the most lightning strikes. Hmm?
Yeah, but not the hurricanes.
Yeah, that too, yes. Alright. What are we worried about with narcotic analgesia with some patients?
Respiratory depression.
Yes. Yep, hypotension, respiratory depression. So you've got to watch out for all of those. Upper airway burns. So you have to be careful if somebody is trapped in a superheated space, right? Breathing in hot air, because what's going to happen?
Barbecue.
It's going to burn their airway, right? They may have soot around their nose and mouth, okay? It's important that you assess them in terms of like having them talk to you a lot, because if there's a change in their voice, that's when you start to tube them, okay? Because it's going to go downhill from there quickly. Not everybody that has like minor airway burns needs to be intubated, but you've got to watch out. Like once you hear a change and they get that something called hot potato voice, that's when you need to RSI them, intube them, okay? Because the swelling has started, right? So they may be coughing, the throat's gonna hurt. You can look in there and see, you know, what's it look like in there? Is it all red? Is it, you know, red and white patches? Is it swollen? But you may be the only person that has the shot of intubating them before their throat swells and closes. Okay, so it's important to be on high alert about that. But we also don't want to intubate somebody for no reason, right? So do your best to assess them and just, you know, keep an eye out. So what do you think we give them in terms of oxygen? Should it be humidified or regular?
Humidified.
Humidified. All right. So we already talked about that. So what happens when you have like initially you have a large burn over most of the body? What does your skin do?
Flakes away. It flakes away. You have a large burn.
Right, but what does its skin hold in?
Heat,
Fluids and heat, right? So hypovolemia is a risk, okay? So in the first 48 hours, there is a formula called the Parkland formula, 4 cc's per kilogram, and you give it over the first 8 hours. You give a certain amount, and then you give half, and then the rest over the other 8 hours. So there's some controversy with that now. Now they have another formula that's 2 cc's per kilo. But basically, you got to give fluid to replace the fluid that they're losing. Okay, but if you give too much, then you know they get very full of fluid. So what do we have to worry about? Basically, documenting the amount of fluid we gave them, and they can figure out the rest, right? So do you want to dump a whole lot in? No, but you do want to give them some fluid, okay? If you got an hour ride down to the medical center, okay, so, you know, maybe you're giving them 750 cc's on the way, okay, if they have a large surface area burn, okay? Along with all your pain meds, most likely. All right. Are we good at estimating our burn surface area?
Rule of
No.
nines.
Neither are the ER docs, we guesstimate. We use the rule of nines, or we can use the hands, like 1% of the person's palm. That is 1% firm, okay? We're not graded. But until they're cleaned up and washed and all that other stuff, that's how you can truly assess them, and that's what they do at the burn center. So we do a guess, all right? If there's lots of third degree, well, that's bad and they need to go to the burn center, okay? Right? Is third degree painful?
Mm-hmm.
Yes.
Yes.
No.
Mm-hmm.
Why?
Burn
All the nerves are burned through. But like I said before, you've got a mix of the second degree and the third degree and the first degree, right? So you're gonna need your pain meds. All right. So the other thing to remember is that, is there any other underlying trauma, right? Because maybe they jumped out over a window. Maybe they crashed their car and then the car went on fire, right? So there's lots of different mechanisms involved. So make sure there's not any other underlying injury, because, I mean, granted, Westchester's a level 1 trauma center and a burn center, but if they're bleeding out from something else, the burns can wait in terms of treatment. It's the stuff that's going to kill them that you want to treat it. So maybe you go to the level 2 trauma center, they fix whatever the problem is, and then they can ship them out to the burn center. Okay. There are some burn centers that are not trauma centers, believe it or not. So, what do you think is one of the hardest areas of a large laceration to control? Like, what part of your body do you think is the hardest?
Junctional areas.
Junctional areas and the neck. Because we can't put tourniquets around people's neck as much as sometimes we would like to, okay? It's very hard to control bleeding there, right? What can you do? Well, you can use a triangular bandage and, you know, put it here and then under the armpit, but mostly you're probably going to have to hold pressure on it, right? So especially if it's like your carotid artery or, you know, kind of a large one, that's going to be a problem. Where do we see like some of those injuries? Prisons, right? And of course, you know, it takes a while to get into the prison, so if it really is serious, they're probably going to be dead by the time we get there, unfortunately. All right, so look over your burn stuff, crush injury stuff, and anything else on here. All right, I uploaded the files, the PowerPoints, so you just have to download them and extract them. All right. I asked somebody to check to make sure it works.
The midterm, is it multiple choice?
It is 50 multiple guess questions. What do you need? Sign in?